Good evening, everyone. Myself, I'm Dr. S. Christy Sopna. I'm a postgraduate in obstetrics and gynecological physiotherapy. Currently, I'm working as an assistant professor in East Coast College of Allied Health Sciences, Pondicherry. I'm I'm thankful to Dr. Vipin sir and also Physioshala for giving this opportunity for me to take a webinar about the most fascinating topic for me on menstrual irregularities. Thank you. So I'm starting the topic about menstrual irregularities. The menstrual irregularities are more common in nowadays. So going into the introduction of menstrual disorders. So what are the menstrual disorders? Is the menstrual disorders or the problems that affect a woman's normal menstrual cycle. So it may include some painful cramps during the menstruation. It may be an abnormal heavy bleeding or not at all having any bleeding. So menstrual cycle is a one. It is an periodic one cyclic event a woman is getting in her lifetime. The menstrual disorders means any painful cramp during the menses or any abnormal heavy bleeding, or the women may not get any bleeding at all. So the menstruation, it occurs between the puberty and the menopause. So menstruation is also known as a menses or period. So going into the definition of what is an abnormal menstrual periods. So normal menstruation, we will define that in the following terms: depends on the frequency, regularity or predictability of these episodes, and the duration of the bleeding and volume or heaviness. So it will comes to abnormal menstruation when the frequency is too less. The women may get periods before the prescribed date. So she may be getting before or after. So the frequency also determines the whether she is getting normally or abnormally. Second one is regularity or predictability, whether a woman can able to predict her next cycle. So a woman, she is getting her periods on 20th of this month, whether she can predict her next cycle on the next month. So that is the regularity or predictability. If the regularity is not there, or a woman, she is skipping her periods for a 1 month or 2 month, after that she is getting, means the regularity is getting affected or the periods become irregular. That also come under abnormal menstruation or menstrual irregularity. So next one is the duration of the bleeding, whether she is getting a 5 to 7 days of bleeding. If it is more than 7 days, 15 days or 20 days, if she is getting, means that also abnormal. If she is getting only the spotting, or 1 day only she is getting the bleeding, or 2 days only she is getting the bleeding also, that also comes under an irregular menstruation. So next one is the volume or heaviness. Volume means how many pads she is soaking. Once a girl achieves as puberty, or if she is getting 4 days or bleeding and she is changing 4 to 5 pads in a day, after 10 years, if her periods is getting lighter, she is getting only spotting in her pads, or she is the one pad itself is not filling out, so the volume or heaviness of the bleeding is reducing. That means she is getting her irregular menstruation. So we will tell the a woman is getting irregular menstruation through this four domains. First one is frequency, next one is the regularity or predictability, next is the duration of the bleeding, how many days she is getting her bleeding, and the last one is volume or heaviness. This is female reproductive system overview. So ovary and the cervix. Ovary. So every month, every cycle, one follicle will get mature, and from that a egg or ovum will get released. So it will go into the fallopian tube. If the fertilization occurs here, so the sperm will come, and if the fertilization occurs here, the egg will move out and it will get implanted in the uterus. Okay, so the menstrual cycle events is splitted into two, one that is occurring in the ovary and another one in the endometrium. Okay, so what is a menstrual cycle? A menstrual cycle, it is regulated by an not only by the hormones, our brain also plays an important role in this. Our hypothalamus pituitary plays an important role in this. These hormones which work together for the synchronized activity between the ovary and the endometrium. Okay, so the area, the hypothalamus and the pituitary gland, it controls the six hormones which are responsible for this menstruation. So the menstrual cycle, first a gonadotrophin releasing hormone, it is released from the hypothalamus. So hypothalamus is a site from which the gonadotrophin releasing hormone get released. So it will act on the anterior pituitary. So it will trigger the anterior pituitary to release the follicle stimulating hormone and the luteinizing hormone. These two are very important. FSH is follicle stimulating hormone, which is very important for the growth of the follicle. That means for the egg to come out, the FSH is very important. Luteinizing hormone means luteinizing hormone is important during the ovulation. Ovulation is the 14th day. So 1 to 13 days, they are splitting into the first proliferative phase, then ovulation, and last one is the luteal phase. So first, the 13 days, FSH will be in the peak because the follicle will start growing little by little. On the 14th day, LH will peak. So LH will peak, LH will do, it will rupture the follicle and the ovum get released. Okay, so FSH is responsible for the growth of the ovum, and the LH is responsible for the rupture and the release of the ovum from the ovary. So it will, from the ovary, it will start producing the estrogen and progesterone, and it will have its impact on the uterus. This is known as an HPO axis. That means hypothalamus, pituitary, and ovary axis. So menstrual irregularity may happen if any one of this point gets affected. So the menstrual cycle comprises of two distinct cycle, one which occurs within the ovary and another one it is in the endometrium. So the ovarian cycle, which consists of an follicular phase, ovulation, and the luteal phase. So follicular phase is this: from starting the ovum, the follicle get the estrogen will increase and the FSH will increase. The follicle will start growing from little by little. So it will reach its point here. Here the follicle ruptures and the ovum get released. That time LH will be in the peak. LH is the pink one. It will get peak during the ovulation. This is the time many of the women will test their ovulation through ovulation kit. So the principle behind the ovulation kit is it will get the LH from the urine. So ovulation kit is an urine test which can be done to check whether a woman is ovulating or not. So it will perceive the LH level in the blood and it will show two lines in the strips like pregnancy test. The ovulation kit is also available. So follicular phases, growth of an follicle. Next to during the ovulation phase, LH will peak, and the luteal phase, during the luteal phase, the progesterone will peak. So why progesterone is peaking in this means, if the ovum gets released, if the sperm comes, if the fertilization happens, so progesterone gets increased means it will increase the thickness of the endometrium so that the implantation of the zygote or embryo will take place in the uterus. If no pregnancy happens means next it will come again to the menses phase. Okay, you're clear, I think. So first is the follicular phase, next is the ovulation phase, and last one is the luteal phase. So this happens in the ovary. The next one is the endometrium. These are the phases in the endometrium. First one is the menstrual phase. So next is proliferative phase. So the proliferative phase of the endometrium and the ovulation phase and the follicular phase, this phase overlaps. Okay, that means the ovum release and the endometrium thickens a stage by stage, and if fertilization happens, the endometrium thicks and wait for an ovum to get attached to it. So if the zygote got implanted in the uterus means it will grow inside the uterus and the progesterone will peak, it continues. If the pregnancy doesn't happen, so it will start it will come out as an menses again. The endometrium will shed off and it will come out as an period blood.